Welcome back to the program. It's still Virus Beyond Borders here on Lagos Television. Our focus this afternoon will be on COVID-19 low fatalities in Africa. Are there factors responsible for this particular situation? My guest will tell us more about it this afternoon. She's a friend of the house. Thank you so much, Dr. Anne Olowu, for joining us on Virus Beyond Borders this afternoon.
Thank you for having me.
Right, let's start this way. As a public health physician, I'm sure you've been following globally what's been happening. And on the continent, there seem to be, yes, people have died, but if you were to compare the number of fatalities in Africa, for example, the figures that I do have here, let me quickly go through these figures and then we can break it down. South America has recorded 1,121,901 deaths. North America 976,381, and Asia 1,104,608, while in Africa we've recorded 190,403 deaths. So this disparity, does it mean anything in the field of medicine?
Oh, certainly. It means a lot, and yes, and it's good that we are discussing this because I get that a lot. That how come Africa has defied the projections and the postulations for how badly it will be affected by the COVID-19 infection. But a lot can be, having looked at it and with the ability to look at it retrospectively, at least with the number of cases that we've had coming out from different regions, a lot of things we can infer that several factors are responsible.
Okay.
One of it is, if we were to look at it, to look at the demography of the continent and the different regions of the world that have been affected, we can see that age has a lot to do with it. We know that COVID-19 infection affects the elderly, right. Especially. It affects. It's more grave. Not that it affects only the elderly. It's more severe with the elderly population.
Right.
And we know that Africa has a very young population. In fact, 40% of the African population are aged below 15 years, and just about 4% of our population are 65 years and older. In contrast to Europe, who have the European region, they have the oldest population, across the world. They have at least 19% of their population older than 65 years.
Okay.
And in North America, including Canada and the United States, and then the smaller Greenland and all that, they have their population, they have 17%, okay. About 17% of their population who are 65 years and older. And so when you look at all of these factors and how gravely COVID-19 affects the elderly population, it is not a surprise that Africa is not so badly affected, okay. Because of the distribution and the age distribution of right. Our population. That is one explanation. Then we talk about comorbidities.
Okay.
We know that people who have comorbid conditions are also, at a risk of higher morbidity and higher mortalities from COVID-19 infection. And so when we look at the pattern of comorbidities, that is when we say comorbidities here, in particular in relation to COVID-19 infection and affectation, we're looking more at heart diseases, we're looking at neurological diseases, okay. We're looking at cancers, we are looking at respiratory problems. And we know that people, populations in the higher income countries, have more affectation of these diseases, in contrast to African regions where infectious diseases are still the bane of our own health problems. Okay. And so you would find that people, our populations that have high comorbid factors like have high comorbid diseases, including heart diseases, endocrine diseases like diabetes mellitus, cancers, are more likely, people there are more likely to have high fatalities and morbidities from COVID-19 infection, okay. In contrast to the African region. And again, that in the African region, we've had a lot of experienced or had to deal a lot with infectious diseases. I mean, and that is the bane of the problem in our health system, dealing with diarrhea diseases, lower respiratory infection, malaria, HIV/AIDS, and all of that. And so, again, and then in recent times, having to deal with epidemics like Ebola, Lassa fever, cholera, all of those things have helped us to, take the preventive measures even more seriously now, and I think has also helped in ensuring that we curb to a great extent the spread of COVID-19 infection.
Right. So you've mentioned age as a factor. You've also mentioned comorbidities, that is living with other health conditions that may also help trigger the long-term effects